Thank you so much for making the time for this. You know this already, but you're someone whose work I cite and look up to, so very grateful to have this chance to chat. So the first question that we have for you is, can you tell us about your current work and how it connects to the field of forced migration?
Well, first, thank you for this invitation. When I think about my work, it automatically goes to the stories of arrivals. There are people who move to survive, and they do so knowing that there are no guarantees in their journey, that they are doing this, they are making these decisions to move because they want an opportunity to live a life with dignity and safety and security. Stress and trauma often threads the journeys of people who move for survival. From the time they leave their home countries, their time in transit, to the time they resettle in new communities. And so my work begins at the relative end of their journeys, where I want to understand the cumulative effect of stress and trauma that they experienced as they were traveling. That there is an impact on mental health when we think about that trajectory and all that is involved in that journey. And so with mental health, in this work, mental health intersects my understanding of what it takes to adjust to life in a new country. And my geographic focus is the United States. More so than ever, the United States is a challenging place for newcomers. There is a positional embeddedness in what it means to be an immigrant, a refugee, an asylum seeker. So whether you are a new arrival or you are part of a longstanding community in the United States, there are a lot of questions on whether you belong, what your value is, if you're safe and secure. And that can place such an emotional strain on people who may already be compromised by past stress and past trauma. Against this backdrop, my research focuses on the intersection of mental health and adjustment, and it falls into a couple of different categories. I'm really interested in national trends, so examining national data on refugee arrivals, looking at pre-arrival experiences, post-resettlement resources, and how the two combined really do influence mental health outcomes and adjustment. I also study the local impact. I had the privilege of starting a mental health program for refugees at the largest resettlement agency in Chicago in 2011. And I directed that program for 12 years, providing therapy across the lifespan, piloting new programs, thinking about how to improve services. But also part of my role there was to input mechanisms for tracking mental health care utilization rates. Who was involved in this co-located mental health program, and how did those mental health services influence how they navigated other support systems in the agency?
Yeah.
And so I do have a couple of studies that tries to understand the profiles of refugees that have accessed mental health care and how that ultimately influenced how they used resettlement programs in their initial adjustment. I'm very interested in intervention and implementation science as well. Co-developing programs with refugee resettlement staff and refugee arrivals in ways that promote the well-being of family and children in particular. We study quite a bit the degree to which these interventions are feasible and acceptable to the communities before we begin thinking about scaling. And lastly, I care deeply about the workforce. We know we don't have enough mental health providers to support the well-being of arrivals. We need to expand our definition of the mental health service continuum from prevention to intervention, and current studies focus on task shifting models that leverage the potential of a non-clinical workforce to be part of a mental health care solution. You'll see in my lab, the Refugee Wellness Lab at the University of Chicago, mental health is the through line in every study that we do. It's what we try to understand in partnership with communities. It's what we aim to translate for other professionals that work with arriving communities. And for me, refugee mental health is not just a subdomain of adjustment. It is a core driver. It influences, it is an expression of adjustment in the US. And so I offer a position in which I do believe refugee mental health, it's relationally shaped, it's culturally constructed, it's structurally mediated, meaning that refugee mental health is something that it's influenced by connection. It is bound by culture-bound meanings, and it is influenced by our environment, including the anti-immigration policies and increased immigration enforcement. And so what I hope to achieve through my work is this reconceptualization of refugee mental health as a central mechanism of how people adjust within and across ecological levels. I also hope to provide practical tools that will translate science for the public good.
I think that is beautifully put.
Thank you.
A second question that we have for you is you're clearly very passionate about what you do. So, what drives your passion for this work?
It may fall squarely in two areas. I am the daughter of immigrants from the Philippines, and so I know intimately the tension of trying to figure out your identity as an American, as a Filipino, and everything in between. I also remember sitting around conversations around the dinner table with my parents, with my aunts and uncles as they discussed the American dream and how it's not always accessible to everyone. The challenges of finding a sense of belonging, discrimination that comes with being a newcomer, but also the resilience in trying to find your footing and make the most of every opportunity given. That is a part of my story. It's a part of my family's story. And it's something that I hold every time I have an opportunity to be with folks that are adjusting in the same way my parents did. The second reason, the second drive for this passion is really the direct practice. As I mentioned, I had a privilege of being in intimate spaces, providing therapy, and I came to deeply understand the suffering that people experience when they're trying to leave their home country, when they're trying to adjust to life here. The challenges of trying to rebuild your life in a place that is sometimes unwelcoming is something that has stayed with me. I had the privilege of being in refugee resettlement programs for over a decade, and so I had a front row to the work, the privilege of welcoming arrivals with dignity and watching resettlement programs have to pivot to be nimble to changing arrival patterns, changing in administrations, changing in funding, and seeing programs getting very creative of how do you continue to welcome arrivals with dignity when funding is changing, funding is limited, and there's so much care that needs to go into the work. And I've also been influenced by immigration policy. I've come to know that you have to be an expert in that to a certain degree and an advocate because policy decisions directly impact programs, they impact the workforce, and it impacts the families themselves, the arrivals themselves. I would say that despite the challenges of the work, I am still driven by this privilege to see the best of humanity. I have seen such love and care and generosity and hope amongst people who have experienced tremendous grief, loss, and sacrifice. I am continually inspired by communities that show up for newcomers and the strength and resilience of the newcomers themselves. And it is such a privilege to be able to work and learn with communities. What are the best systems to support the mental wellness of these communities in tandem, not in isolation, but together? And in doing so, I think the privilege of being able to do this work, I feel a responsibility to pay it forward. I've had really great mentors, really great opportunities to learn in these spaces. And so part of the passion is to be able to train social workers, the next generation of researchers, to continue to ask these important questions and contribute to the community.
Yeah, that's amazing. And I think leads us very nicely into our next question. Considering how deeply and intimately familiar you are with both realities of research practice, but also policy, and considering current research and literature, what gaps do you believe require further exploration?
I continue to believe that we need to expand our conceptualization of mental health within acculturation and integration research. We have a lot of indicators of adjustment that focus on employment and housing, English language capacity, but there's so many other indicators that we're not including. Community informed indicators, relationship indicators, family well-being indicators that I would love to see reflected in the literature more. I do think we need to do a better job of lifting up community voices and community and cultural meaning systems into our mental health care models. More evaluation of community-led and healing-centered interventions. And we do have an opportunity to better translate global wisdom, Indigenous healing practices into our U.S. mental health care framework. And so these are areas of work that we're starting to see, we continue to see, but I'd love to see more movement that really focuses holistically on what mental health can be and how it informs our understanding of this adjustment integration dynamic.
That's great. And you also mentioned that you care deeply about paying it forward, training this next generation. And so, what advice would you offer to students or early career scholars that are interested in this field?
That's a good question. If you are interested in this field, I would encourage you to get to know the communities you seek to understand with a relational and human lens before you begin drafting your research questions and your methods. There is an opportunity here to leverage the communities you seek to examine, the communities you seek to explore your questions with, involve them in the teaching and learning process, because that will more deeply inform how you ask your questions, when you ask your questions, and why you ask your questions. Early career scholars in this area certainly need to understand systems and policies and the downstream effects that influence the daily lives of the communities you seek to understand. And there is an opportunity to be curious, to consider the untapped skills, knowledges, and capacities of the communities you're studying, and the ways in which those understandings, those skills, that knowledge is not always reflected in service delivery systems, in policies, and even our research designs. So to get to know the communities.
That's wonderful. And then our final question is there a book related to forced migration? It can be a biography, a novel, or a textbook that you would recommend.
Because I really want to emphasize the importance of community voice, I have two recommendations.
I love that.
The Displaced by Viet Thanh Nguyen and The Ungrateful Refugee by Dina Nayeri. These are stories of survival, people who move for better opportunities, and these are books that also talk about the burdensome assumptions and expectations we place on them.
Mm-hmm.
So, good reading for the weekend.
Thank you so much. This was great.